In the ongoing fight against Kush, a joint task force comprising personnel from the Ministry of Health and the National Drug Law Enforcement Agency known as the National Task Force for Drug and Substance Abuse convened a press briefing on Thursday, May 9, 2024 to provide updates on their recent endeavors. The press briefing aimed to inform the public of the government's initiative to stem the tide of Kush smuggling and usage within the country. Kush, a blend of cannabis, fentanyl, tramadol, and purportedly even ground down human bones, has been identified as a significant concern. Studies indicate that Kush strains often lean towards indica dominance, resulting in potent sedative effects compared to sativa dominant strains. During the briefing, Musa Kamara, Regional Director of Health Service, delivered a summary of reported cases and individuals seeking assistance from various healthcare facilities across the nation.
Total of 89 suspected cases who reported to our health facilities, and their age range is 14 to 58 years, who are suspected of using the drug and substance. 87 out of this number, 87 are males, and 2 are females. And out of the total number of 89 cases, 4 have died. And the facilities where the cases mainly reported included Serekunda Health Center, Banyulunding Health Center, Edward Francis Small Teaching Hospital, and the Kanifing General Hospital. These are the areas where the cases have reported.
Mr. Kamara also implored the public, particularly communities near the borders, to aid in combating drug and substance abuse, particularly among the youth.
So we want to implore on the general public to help us in the fight against the suspected drug and substance abuse among the youth cohort. We want to also put across to all the families, especially the influential and opinion leaders at community level, to be vigilant in complementing government and partner efforts in the crusade against the illicit drugs and substances, especially for communities that are living around the border.
Commissioner Pasamba Bojang, Task Force Chairman, disclosed that the Drug Law Enforcement Agency has recorded 70 cases in the first quarter, providing details on the nationalities involved.
When it comes to the interdictions at security level, the Drug Law Enforcement Agency registered for the first quarter 70 cases. Out of 70, it involved 90 personnel. You know, when the difference between 70 and 90, some of the cases are joint cases. Some of became individual cases. That's why we have 90 as a total case for the first quarter. Out of that 90, we have 5 females, ladies, involved. And in general, we have a total amount of 60 Gambians, 27 Freetonians, 2 Senegalese, 1 Nigerian, and 1 Guinea-Conakry national. And all these cases have been processed, and some of them are already been mentioned in court, others are about to be mentioned in here. That is for the interdictions at delicate level.
Emphasizing collective responsibility, Bojang stressed the ongoing threat Kush poses to Gambian youth.
We can only make difference when we work collectively. Today, the figures are dropping, but doesn't mean that it's not existing. Kush is still in town. We share information. All of us are a victim, direct or indirectly. Because if you feel like my brother is involved smoking cannabis, drug have a cycle level. If he's involved in cannabis smoking, you didn't help him, he became addicted to it, the next minute he have to go for another substance because he's already been tolerant, he's tolerant to that particular one. He needs additional dosage. and he may end up seeing himself in this Kush.
Lamin K. Jobate, a drug demand reduction officer representing the Drug Law Enforcement Agency, outlined plans to fortify border security to prevent the influx of Kush into the country.
As you can understand, with the issue of Kush, we understand it originated from somewhere within our neighborhood, from a neighboring country. But we have our plans, to have secured all our borders. But you can always remember also that the Gambia, our borders are porous. You can dodge our official border lines to enter the Gambia and to move out. So, but better still, we have more officers, ever ready than ever. And we have sister security services who are also ready to support our operations. So at any time we have operations and we need their support, they are ever ready to be with us.
Furthermore, it is crucial to recognize that individuals grappling with addiction often face additional health complications ranging from pulmonary and cardiac issues to mental health disorders. The proliferation of Kush has sparked widespread concern, prompting calls from social commentators and politicians for decisive governmental action. Consequently, the Gambia government established the task force to combat the Kush epidemic. Reporting for Kirfatu, I am Ramatulai Jao.